Hello. I would like to welcome everybody to this second public event of our project, ProGender, but it is the first online discussion we organize in this project. My name is Maria Stratigaki. I represent here the Center for Gender Studies at Pantheon University in Athens, and I'm very happy to start also our online discussions with this very, very interesting topic. 2 words on the project and 2 words on this discussion. About the project, I would like to inform everybody, because we have maybe people who were not here at our first public event, the lecture. Now we have maybe new people, so please know that ProGender is a bilateral activity between Greece, Norway, and Iceland, funded by the EEA grants. And the aim of this activity, of this project, is to create a digital hub devoted to gender perspective of COVID-19 and its aftermath. And of course, the gender perspective means how COVID-19 has influenced our lives. But from a gender perspective or gender point of view, we have 5 topics, 5 areas, thematic areas where we are going to produce. We're going to deliver lectures, these online discussions, debates, seminars, workshops, reports, video, podcast, and educational material. The project lasts for 18 months, so we are at the beginning now. The five thematic areas where we are going to work on is gender, care, and labor, the first one, and we are still with this online lecture, online discussion. We are just at the first topic, but there will be 4 more topics: gender-based violence, women and gender in science, gender and communities, and women in governance. In this very exciting project we have almost started recently, we collaborate very close with the Institute for Gender Equality and Difference at the University of Iceland and the Center for Gender Research at the University of Science and Technology at Trondheim, the Norwegian University of Science and Technology at Trondheim. So we will have 18 exciting months in front of us with a lot of activities. Please join us, follow our Facebook, and you will be informed about the events. By next June, we are going to organize 8 more events. 4 more, this means 4 more lectures and 4 more discussion panels like the one today, on the different topics I have just mentioned. So 2 words about our topic today. In the framework of the general topic gender, care, and labor, we organize now something on the care sector. So we know very well that in the care sector and the health sector, the gender challenges are very, very important because there are a lot of women who work in these sectors, but the work in these sectors influence the life of all other women remaining home and trying to work in a remote way. So the people working in hospitals, schools, kindergartens, elderly care centers, the majority of them, as I said, they are women, and also there are a lot of ethnic minorities among workers in healthcare and cleaning sectors. Although these women work at the forefront of the struggle against the pandemic, putting their lives at risk, their contribution remained undervalued and unrecognized because of continuous structural inequalities and biases characterizing these feminized and often racialized professions. So we want to address these issues we would like to argue that these services are essential services because they offer very much of our well-being and also of our survival at this moment. We have 2 speakers from Iceland, 2 speakers from Norway, and 2 speakers from Greece. My colleagues at the Center for Gender Studies, Nelly Kaburi, that you maybe all know, and Thomais Kavura, are going to coordinate this discussion today. And we thank you again for being here with us. And we hope for a fruitful exchange of experiences between these 3 countries. And then we thank again everybody for being here. So Nelly Kaburi is going to coordinate and present the speakers. Thank you.
Hello, welcome. And I would like to express a very deep thank you to the speakers because this is a very important discussion for our societies. And I think it's crucial that we elaborate on these aspects of work that are so important for our survival during COVID-19. So we will start our discussion with Christine Durfjord, who is Associate Professor at the School of Humanities and Social Sciences at the University of Akureyri, Iceland. I hope I pronounced everything right. But this is part of what we're trying to do with this interconnection between Iceland, Norway, and Greece. And I would also like to say that we would follow, for the first intervention, we would follow the sequence of speakers that we have posted on the chat. Okay. We would like to mix experiences from different countries, so we will not take each country separately, but discuss specific issues in each country. So Christine, you have the floor. Thanks.
Thank you. I will go through a few slides, so I will now share the screen with you. And here it is. I am going to present to you for you a little bit about a survey that we did in the middle of the first wave of the pandemic last spring. In the preschool sector. I will tell you a little bit. In Iceland, about 97% of 2 to 6-year-olds are in the preschool, and they are the whole day in the preschool. And about 80% of the children from about 18 months to 2 years old. So most of the children in Iceland are in preschool, and the preschool are actually, I think, one of the biggest part of why Icelandic women are so how greatly they're participating in the labor market. They have the opportunity and the means to do it. I wouldn't, obviously there's a family, but still it started off as a women issue, having the preschool for all children. So, and in the preschool, we have mostly women working. About 2 or 3% of the workforce there is men. So this is, and it's also especially about for the unskilled labors, it is a low paying job. So that's kind of the big picture of the Icelandic preschools. This is just a little glimpse into what the people are saying, that they were so proud of to be on a duty to be a frontline worker in the beginning, but at the same time they thought it was important role in the time of COVID, but at the same time many felt that they were kind of thrown for the lions, but that will come later. I'm not going into this, but this was 2 surveys, and it was open for all people working in the preschool. So, and we got about 650 and 730 answers for the surveys. So what did we learn from the first wave? That's where I'm going to use the time. 55% of the workers were surprised that they became frontline workers. They didn't expect it. They thought they would kind of be will be similar things as in the primary school, where they closed the schools, or had children for a short time of the day, but that didn't happen in the preschool. So the preschool were open during the first wave. 32% said that they had anticipated it, and 13% had not made any, didn't think about it before. 5% of the respondents thought that the preschool should be closed. 12% wanted them to operate normally, but 58% wanted to be only open for the frontline workers, but they were open for all children, which in hindsight we think actually is very important. Here I want to just go, because we are talking about labor and emotions. People were thinking, because in Iceland, early childhood is part of the educational system. It's looked at as a school for children. But when the pandemic hit, they felt that they became first and foremost service, not a school. So they were service for others, for service for the other frontline workers, and service for just to hold up the society and keep it going. And they were doing jobs that were not part of the job description, and they didn't get any paid and not paid extra for it. So they kind of were stuck in a world where they didn't know anything about. They were not protected against, for example, they didn't have masks. They just had sanitizer for their own protection. And a lot of the time in the preschool went into sanitizing everything. So they felt powerless concerning their working conditions. And that was a feeling that was very strong at the time. Many were optimistic, and they felt they were coping well with problems, and they found it beneficial for them to be working. I have to make this, yeah. But annexity was also a factor that separated the groups. For example, unskilled workers, people without education, people without maybe the ability to read into the scientific data that was presented. They were more anxious than, for example, the preschool teachers. And another part of it is that it is also the younger people that were more kind of stressed out by the virus. And part of it is also because 2009, 8 and 9, when we had the bank, forgotten word for it at the moment, but when everything collapsed, financial collapse, those young people were teenagers. So they are going into the second big kind of stressed, kind of, this is their second time that they go into this kind of a situation. So they are maybe also, they are also vulnerable to this kind of to this kind of a big event. And people were also proud. They were proud and thought it was important to be participant in the social project of keeping our society going. So there was all kind of mixed feelings with the people in the preschool, and they kind of in the same person you could find the mixture of being afraid for your family and taking the virus into your home, or taking the virus from your home into the working place, and at the same time being proud of being in the front line and doing this important job. So this is kind of where I thought was just for the few minutes. So we have this people feeling in different directions. I think that's about it for now.
Thank you for this. It's very helpful. We couldn't get any speakers to speak about preschool in Greece, but I have to say that pretty soon in March, when the lockdown started, the preschools were closed. So we didn't have the same experience. They were opened afterwards, but for most of the pandemic, we've spent it with preschools and schools closed.
In Iceland, it was different between preschools. Some preschool had half of the children, some preschool had all the children. So it was different, but all the preschools were open.
Okay.
And they were open, but many parents chose to have their children at home. And we found out that the children that were staying at home were, for example, children from migrant children.
Okay, that's useful to know. Okay, thank you, Christine. Now we move on to Sile Naustvik, who is a deputy head of the Norwegian Nurses Association, and she would give us the picture of what is happening in Norway in this very essential sector. Thank you.
So thank you very much, Nelly. Do you hear me? Okay.
Yes, yeah? We can hear fine.
Okay, good. As you said, my name is Silje, and I'm the vice president of the Norwegian Nurses Organization. We have actually over 120,000 Norwegian nurses in our organization, bachelor and master degree nurses, and mostly women, as you do know, 90% or so. And they have been and are standing in the front line in the battle against the pandemic. So thank you very much for bringing gender and COVID-19 up in the public debate. I'm very grateful that you do that. Also, in an international perspective, is that very interesting for us from the Nordic eyes and from Norway. So the nurses in Norway, they work in hospitals, in the ER, at test facilities, nursing homes, and home-based healthcare, and I would say also many other places, but mostly those. And the work we do has seldom been so celebrated. We get praise, applause, artwork, and whatnot. And of course, we do appreciate that. And the pandemic has really highlighted the challenging facing healthcare system that is not rigged for pandemics like COVID-19 or crisis over such a long period of time. In Norway, we have a massive shortage of healthcare professionals, nurses in special. And the scarcity of this life-saving competence is a great challenge for our welfare state, which we are very proud of, but it's a challenge for us today and definitely in the future. I would say that when Corona hit us all in March, the measures taken to prevent the virus from spreading was based on the fact that we did not have the capacity in the hospitals to handle a wave of very ill Corona patients. So that would break the back of the healthcare system, and I believe that many countries in the world has faced that very hard reality. The pandemic has revealed the important roles and functions that nurses play in all parts of the healthcare system. But despite this, there were no seat at the table for us in the Corona Commission, a committee appointed to investigate all sides on how the authorities have handled the outbreak of the pandemic. Just a tiny, like the commission is of course led by a male physician, and they have 5 more male physicians in the same committee, but no nurse. Nor have we been offered full-time positions or better pay. The wage gap between men and women are the same. Nurses are still underpaid and overworked, to say it in the large letters. And instead of offering more pay for positions and better work environment, we experienced employers that in some extent took advantage of the situation and misused an agreement meant to solve an acute situation with Corona patients. Unfortunately, also workplaces with no COVID among patients force the nurses to work longer shifts and more days without time off. So, and one last point is that the pandemic is not over. It's absolutely very much here. And it's not the first pandemic and will not be the last. So we need to make sure that we in the future build healthcare systems that can manage crisis, because they will surely come. Climate change and demographic changes in Europe in special is saying that this will happen again. And in Norway, 1 out of 5 nurses quit their job in nursing before they have worked 5 years. Most nurses work part-time. The average retirement age is only 57. So we need to take seriously that in order to recruit, retain, and mobilize nurses, good working conditions and pay must also be ensured. So that is what will hopefully ensure a public equal health service also in the future. Thank you.
Thank you. That's very, very interesting and very alarming at the same time, I think, what you just described. We will move on to Janis Polykandriotis, who is the General Secretary of the Pan-Hellenic Trade Union Nursing Federation of the Hellenic National Health System, who will also give us a brief outline of what the situation with nurses is in Greece. Thank you.
Hello, everybody. Invitation. As Silly said before, in Greece we have almost the same problems according to the crisis. Found our system not ready enough to take deal of the coronavirus. We took immediately strict measures about to reduce the patients to come to the hospital. The nursing staff in Greece is a very high, is a very low rate among the European. We have more doctors in Europe and less registered nurses. The beginning of the pandemic found the nurses prepared because we have in the past time, we have to deal with other pandemics, but our system was not ready about the clinic beds. In about the meantime, according to from March to 20 to now till now, we have more beds of ICU the patients, but we've got really problem to the human resources with nurses. We don't have nurses in Greece, registered nurses. The Ministry of Health makes efforts to take to hire more nurses, but we face a lack of them because we have a lot of Greek nurses to go abroad to England, to Norway, Sweden, and in our hospitals here, we have little human resources of nurses. We are facing it. We make efforts every day to take control of the pandemic. We are in a good level right now about the pandemic to how we treated them at hospitals. That the pandemic in Greece is always go higher and higher, but we can make efforts to handle it. The wages, as Silly said, here in Greece, the nurses are not paying enough. We are facing problems such as a lot of hours to work. We work sometimes without a day off. but we are trying to keep the health system on its feet to take the deal with the coronavirus pandemic. In brief, I just describe you in shortly what happens in Greece. We make our efforts every day. We push the Ministry of Health to make to take more nurses to the system, and we believe that all this it's going to be an end shortly. But we're daily we're keep doing our efforts to help all the patients with coronavirus to get back home safe. That's all I have to say.
Thank
Thank you
you.
very much.
Thank you very much. And now I have made a mistake in the sense I would like to give the floor to Dimitris Haralabopoulos, who is also representative of Nurses Association Confederation, POEDIN. And then we will go to Sonia. Okay, Sonia, is that okay with you? I hope it is. Is Dimitris Haralabopoulos? Hello, welcome. You have to unmute your microphone. We cannot
Okay,
hear.
it's okay now. Okay. Good afternoon. Thank you for the invitation. My name is Dimitris Haralabopoulos, and I'm working in Hagia Sophia Children's Hospital as a nurse, and I am a member of the Pan-Hellenic Federation of Public Hospital Employees General Council. I'll try to give you a picture of what happened here in Greece during pandemic COVID-19. Sorry. And, let's start. During June 2019, the Greek healthcare system was just coming out of the dark days of the memorandum. Unfortunately, its recovery was interrupted by the new of the time great government, whose goal was to undermine the public health care system and replace it with a private one. As they probably would have succeeded if not for the COVID-19 pandemic. Let's see in which state we were before the pandemic in July 2019. All Greek citizens had access in a free public healthcare system. In the past 4 years, 19,000 permanent recruitments had occurred. Hospitals had modern equipment, and hospitals that closed down during the memorandum's years were against operational. The new government made zero action for the healthcare system from July 2019 to February 2020, when the pandemic reached our country. In the pandemic, everyone in Greece, including the government, recognized the importance of the doctors' and nurses' work as well as their sacrifices. And then they applauded, and then nothing. The system was not prepared for this. The beds in intensive care units were not increased. No permanent recruitments of medical staff done. Many of us were hired in temporary job positions. The personal protection measures were not sufficient. The hospitals were not capable to nurse all the patients with COVID-19. Doctors and nurses work without days off. Doctors and nurses move from hospital to hospital. Hospitals become one disease hospitals. All these result in the exhausting of the hospital staff and strikes against an absent government. But in spite of all the aforementioned issues, we have something good here. The fact that a well-managed and founded public healthcare system is the strongest weapon of the people against a pandemic like this. This is now clear to everyone. This is why we need funding, buildings capable to hospitalize any disease, well-educated staff, permanent recruitments of medical staff, well-organized primary healthcare system, salary increase, and last but not least, the recognition of the public healthcare system importance by the state. Thank you.
Thank you very much. I think we have a very complete picture of what is happening in the nursing sector in Greece. We now move to Sonia Iborbeksdottir, I hope I pronounced that right, who is the chair of the Federation of State and Municipal Employees in Iceland.
Thank you. It's a very good pronunciation. We are all the daughters or sons of somebody here in Iceland, so that's why we all have the same ending, depending on if we're male, female, or male. So I'm the chair of the Federation of State and Municipal Employees in Iceland. It's an umbrella organization, and we have 23 member organizations, and well, our members work all over our public servants. So we have a lot of diversity, and in Iceland, as Kristín mentioned before, women are generally in the labor market. The employment rate is very high in Iceland. It's about 80% of women who are working, and within the health and social sector, there's about 75% that are women, and they are 73% in education, and then 57% in retail and services. I wanted to share with you a little picture here, just to give you maybe a backdrop of how the waves have gone through here in Iceland of the pandemic. So we had our first infections at the beginning of March. Yesterday, the news were telling us about that the first instances had come up a year ago, and we talk about that we say that we have had 3 waves, but as you can see in the picture in the blue color, that is those who have been isolated or have been infected, and it more kind of looks like 2 big waves. And that is the time then from the beginning of March until the beginning of May last year, and then in September last year until just before Christmas. That was the time that the most distress was on our systems. From the beginning in the health sector, the employees did not have any complaints about the PPE. They were getting their gears to protect themselves. Also, even though also there's quite a need and of nurses and nurses assistants and etc. During these waves, the system held, and we did not have the same situation where people kind of could not go home, but of course they worked overtime. And we hear from people that, of course, due to the pandemic, they've made some sacrifices on the lines of isolating themselves, just going back and forth from work and trying not to meet other people during the way. Of course, there's a variation of measures that have been made from between the different sectors, whether it is in healthcare or education, but we can see anxiety rising and more with women than men. And also just it has been spikes in the stress for public servants, and the latest numbers we have on that is that about 66% think they are working under more stress now than they have before. About extra payments, because we in the public sector, we reach conclusions in the collective agreements just before the pandemic hit us, or at about the same time in March last year. But there was some demand about extra payments, and those working within the hospitals in Iceland received them. But we in the unions are not very happy. They were not very high. And also we said that there are more people working in the front lines who deserve extra payments as well. We are now, of course, quite worried what the long-term effects will be on people. Because if we say that our system survived, it's because of the people who kind of bore the burden during these waves. And maybe just as a conclusion, I wanted to mention that in our collective agreements that we signed last year, we had clauses about a shorter work week, which will have an impact on women working in part-time, because the public servants, and especially those working in shift work, they are usually about 70–80% of them are women, and also about 80 to 90% of them are working part-time. And in these agreements, because of the shorter work week from 40 hours a week to 36, and also they can get more free time down to the floor of 32 hours a week, they have the right to increase their work percentage. So the medium of that is about 10 to 12%, and it will come into effect May 1st this year. So we are very excited to see the changes on the payments that will have. And also during these collective agreements, we were in discussions with the Icelandic government, because we wanted to, well, take some steps forwards to eliminate the gender pay gap that derives from the gender segregated labor market, kind of the women's jobs and the men's jobs. And there is a working group working on proposals on that ground that's supposed to, well, hopefully we will be done by the summer. So those are kind of the next steps for us in this question. Thank you.
Thank you very much. That's really interesting, because we go into the policy aspects of the pandemic, and I would now like to give the floor to Aurora Tambanking, who represents Melissa Migrant Women's Network. Migrant women's work has been very important in Greece in sustaining labor relations and also care. It has been very important because it has been it has given the chance for private households to substitute with relatively low without low costs the lack of welfare protection by the state. And the migrant women have been for many years covering for the lack of public health care, both with regards to childcare, especially early childhood care, but also with regards to elderly care and cleaning, domestic work, and elderly care. So Aurora, I give you the floor. Can you just unmute your microphone, please?
Yes, hello.
Hello.
Can you hear me?
Yes,
hello.
We can hear you. Yes, we can hear you.
Hi, good afternoon. I am Aurora Tabangin, who is working in Melissa Network of Migrant Workers and also working as a domestic worker. I can say that there is a problem of the work. I can tell you the working conditions of domestic workers here in Greece. I think domestic workers are the most affected with this COVID-19 pandemic. Workers like part-time or working in several houses are not just go to their job because of many restrictions of movement from the Greek government, and second, because employers are scared that they might have the virus and spread it to their families. Many part-timers lost their jobs because of this pandemic. They have having a great financial problems, especially where they will take to pay their rents, bills, foods, and for their families. And also, I can say that workers working in different houses cannot go job because of many restrictions, and vice versa, because workers working just in one house or in one house, the employers are using this restriction to get advantage of them. They don't let their workers to have their day off, which they are entitled to have 2 days off in a week. They said not to go out or not to go to their job, to their flat, because they are scared that their workers will have the virus and spread to their families. They were told to stay in for 7 days a week until the pandemic will be over, without going out, seeing their families, without social life, and without increase of salary. And sometimes there are employers who are, instead of increasing their workers' salary for the additional 2 days work, they are decreasing it. I think one problem here for the domestic workers here in Greece. Thank you.
Thank you. And I think it's important to stress that especially the elderly care sector, because of all the municipal structures for the care of the elderly, the so-called CAPI, where people could go and several needs could be taken care of, were closed since March. And elderly care was overwhelmingly taken care of by migrant live-ins.
Yeah.
Yeah. Do you want to add?
Actually, since March 2020, Melissa is closed.
Okay. Yeah, that's the other
because of this problem with the migrants, because there are many how do you call this? How do you call those people? The migrant going there and staying there. The refugees, especially the refugees.
Okay.
Because most of the refugees, we are having refugees there, like for example, like more than 100 a day, to feed them, to have their education there, to learn some basic things from here in Greece. Now it is closed, so that is also a big problem.
I mean, to explain a little bit what Melissa does, Melissa is a network created by migrant women, which provides support for other migrant women, and also for asylum seekers and refugees. And they provide daycare for children, legal support, social support. Yes, go ahead. Sorry, Aurora.
Yes. Yes, and they have they have also childcare there, and how do you call it? Feeding them also. They're trying to give them, to help them mentally.
Yes.
Also, because of the problems of where they are, mostly of the refugees, because they have, most of them have mental problems. I mean, psychological problem, not mental problems. Sorry, it's psychological problems, and Melissa is helping them to overcome this.
Okay, thank you very much.
They're having
it's very important to stretch these intergender aspects of care work. And we move on now to Christine Somerset Bjarnes, who is an international advisor at IPPF Norway, which is an organization that deals with sexual and reproductive rights.
Thank you. Thank you so much for inviting me to join the panel today. And thanks to everyone for very great presentations. It's been a pleasure to sit and listen to all of you. I, as you said, work in Sexopolitikk. That's what we're called in Norwegian, IPPF Norway in English. We are a non-profit and politically independent member organization that works to strengthen and promote sexual and reproductive health and rights in Norway, but also internationally. And I work as a political advisor on topics related to SRHR internationally. So this includes access to abortion, contraceptives, and comprehensive sexuality education. And we are the Norwegian member association of the largest federation for sexual and reproductive health and rights in the world, called International Planned Parenthood Federation. So we have sister organizations in 129 countries, in which most of them provide sexual and reproductive health and rights services, and they have clinics. In Norway, we do not, but we develop comprehensive sexuality education material for teachers, and we mostly do political advocacy. So my thought was that I could contribute today by sharing some examples of how the COVID pandemic has effects on sexual and reproductive health and rights. But I want to start by saying that we're still lacking research and information on these issues. But I am able to say something about early figures and some examples from different contexts where we have close collaboration with our sister organizations. So that's mainly then about access to reproductive health care, to the clinics, and to contraceptives in particular. So what we do see worldwide is that many SRH clinics for a period or still had to close due to local or national restrictions. In addition, has lockdowns, travel restrictions, both national borders, but also within countries, and curfews had an effect on access to contraceptives and other reproductive healthcare services, because it has made it difficult for people to travel to clinics. In some cases, it has not been allowed. And also, in addition, that people have a fear of getting ill, they don't want to move too much around, or they don't want to put too much pressure on the health system and therefore not seeking healthcare. So IPPF, our umbrella organization, has for the past year conducted 3 rounds of different surveys. They have been internal surveys that has been shared to all of the member organizations. One was conducted in April, one in June, and one in November. And numbers from April shows that 66% of all IPPF's organizations that provide services and have clinics had to reduce their services and offers. So that's more than half of the clinics in a total of 64 different countries. Also in April, 1/3 could also report that they were lacking contraceptives. The third and latest internal survey that was conducted now in November shows, luckily, that the numbers of member organizations reporting that services were closed have declined. So we are seeing that the situation is getting better, but there are still organizations that experience closures, and most of them are in East and Southeast Asia, and also in the Africa region. For instance, then in November, 859 clinics or service delivery points in the African region was still closed due to COVID. Another example or reason for how access to contraceptives has declined during COVID is, for instance, the condom factory in Malaysia called Carex. They stand for the production of 1/5 of the world condoms, and they were closed for 10 days in March 2020, and they ran on half capacity in April. So during that time as well, they were also struggling to bring in the raw materials that they needed for the production. And the last that I saw from Cardex was that they also in October said that was like 7 months after they had to close, they were still dealing with a backlog of orders. And the last example, I saw now figures from Guttmacher Institute that shows that 1 in 3 women in the United States reported that because of the pandemic, they had to delay or cancel visiting a healthcare provider for sexual and reproductive healthcare, or had trouble getting birth control. And that barriers to care were more common among Black, Hispanic, queer, and low-income patients. So that's also just to show that these are not just issues happening in the global south, and that also that the consequences are hitting disproportionately, as we know. So I think that's maybe where I will leave it for now. There are tons of aspects within sexual and reproductive health and rights that we could and would be useful to dive deeper into. And I'm really also hoping for in the future now that I will see more research done on these issues. It could also be on topics such as abortion care, teenage pregnancies, child marriages, violence. And that's something that we as a civil society organization and also political advocates really see the need for. So thank you.
Thank you very much. I think this was a very interesting puzzle of all the different aspects of care work and the labor aspects of care work during COVID-19. We would like to, we have some questions right now, so we would like to open the floor to the questions, and then we would also like to move on and ask questions about the policy aspects and what needs to be done, and how this is related to work-life balance, more specifically for the workers of for the care workers, but also for the people who are affected by the crisis. So, Thomais, would you like to?
Yes, we have a question from Ms. Christina Padzou. It's about Mr. Polycandrioti and Mr. Haralabopoulos. The question is, what's the percentage of women that represent in the Greece's nursing staff? How many women members does the union have, and how many women participate in their association? Finally, could they tell us about some of the gender issues that have arose during the pandemic crisis? Mr. Polycandriotis and Mr. Haralabopoulos?
And also, before they respond to that, also, if there are any other questions, please send us the questions or raise your hand and we will give you the floor. So who would like to start? Mr. Haralabopoulos, would you like to start, or?
Would you like to repeat the question?
I have also sent it to you in the message in the messenger. You can see it.
Yes.
So you can see if any one of you is ready to respond.
Dimitri, you want to answer first?
Yes, sure. Go ahead.
All right. All right. At the union, we have almost 43,000 registered nurses as union, registered nurses. Most of them are women. During the crisis, everybody faced many problems. But women, they have faced a lot of more problems. Because they have to take care of their family also. Another one problem that we have to face was the couples of nurses, when the man's a nurse and the woman's a nurse also, and they have serious problems with their work at hospitals. Women's usual works by day, and men nurses work afternoon or night. We have a special days that they are off of their work. but the pressure of the job at the hospitals is very big. We have serious psychological problems. We make teams to teams at hospitals in order the nurses to have someone to tell about their problems, like psychological teams. But the main problem is how to deal with the coronavirus when you go back home, when the society they are in somehow they afraid of us in order not to give them the pandemic, to transplant the pandemic. But 1 year now, as the pandemic continues, we can say that we can deal with it in normal conditions, although the main problems are here, and we are going to face them in the next 3 or 5 years because the psychological damage which has been done to nurses is very big one, and especially in women nurses.
Thank you very much. Mr. Haralabopoulos, would you also like to comment on this question to respond? We cannot hear you, unfortunately. The connection is not very good.
Do you hear me now?
Yes.
Yes.
Okay. I agree with Janice, and I would like to say that the male nurses are very lucky here in Greece because the majority of the staff is women. We have a lot of women. I would like to say that it might be a problem about our salaries because we become from a period that only women was nurses. This is the result of all this. I believe now the things are better. Now, in our union, all of nurses are members, but in our councils, women are have a low, there are not many. We have about 20% women in our councils. They don't participate in these things. And finally, I don't believe that during pandemic there are problems because of sex. I think that in our days, women and men doing the same things are in their homes, and the problems are common. I don't know there are problems. I don't believe that there are problems because of the sex. The problems are common.
Well, I think that maybe the other speakers would like to give their views on the work-life balance issues, because most of our experience and most of the studies show that women are overwhelmingly burdened by reproductive issues and by care at home. So usually it is women who are the ones who suffer mostly from the double burden of having to work and having to take care of their families. And I think also this is shown in the underrepresentation of women in the labor unions in Greece that you described. They are the majority, but at the same time they are not equally, they are not at the top levels, and this shows that probably there are very important structural issues that prevent them from joining the unions in a more active way and getting more. So this is something we can discuss further, but I would like to ask the other speakers if they have comments to make about work-life balance and their experiences. Is there someone who would like to comment on that?
For example, we interviewed parents during the pandemic, And we found out, we were interviewing 12 families, and we found out that more or less it was on the shoulders of women to keep the children occupied and working away, working at home. So, and most of the people that wanted to participate in our research were also women. We didn't, we had a few discussions with the fathers, but mostly it was the mothers. And they described, their workload was kind of a double, or they had a lot of. So I think it's a gender issue, and I think it's a kind of a, in our country we are on the top of the gender gap list, but still we have this unbalance between women and men at home and in the domestic works. So, and you were describing before the women that were working as in the homes in Greece were mostly, she was talking mostly about women. They're not men that are working this domestic work. So I think this is on the shoulder of women, just, but maybe somebody has more to say about it.
Thank you. I mean, I have next Maria Stratigaki and then Sile. Yes? Maria, would
maybe
you like...
maybe Sile on this question, or because I'll raise a different question. Sile, do you want to reply to this?
Just a short reflection on this question, because also in Norway, where we presumably are quite equal, this is absolutely like, I would say, I have 2 small children, aged 3 and 6. And I also am the vice president in a large union, which is not very common because work-life balance takes a toll. Who will take care of the children? Who will pick them up from kindergarten and so on? But more important in this discussion, I think, is the nurses, from my perspective, or other women in public services, because actually most nurses in Norway work part-time. Over 70% of Norwegian nurses work part-time, with the consequences that have. And that is, of course, because of the combination between the difficulties of the work-life balance and also the workload and shift work that you have to work when you're a nurse. You have to work the weekends, you have to work evenings, you have to work night shifts, you have to work Christmas Eve, So if you want to get that together with a family life, most nurses work part-time, and so they get poorer pensions, they get poorer salaries. It's a lot of the structural issues is also a big problem in Norway, and and the discussion here is, do they work part-time because they want to work part-time, because we're blessed, we can live on a part-time wage, or do they work part-time because society tells them that if you don't, you're not a good enough mom, wife, daughter, and so on.
Thank you, Sile. Maria, we have one more question. We have one more comment from Sonia.
Yes.
I don't know, is it on this topic, or do you want to?
Yeah, is it okay if I just comment shortly on this topic?
Yes, sure.
Just because, I mean, this has been a part of our debate for many years within my federation, and it's clear that in Iceland and also in all other countries in the world, the responsibility of the household chores and the children is on the shoulders of women. Of course, it varies between countries how much the men and the women divide these burdens, but in general, it's always the women. So like Silja and Kristín were trying to tell or discuss here, I mean, that is the reason that women are seeking to be working part-time. It's because of the family burden. We have a lot of research showing that that is the reason. And of course, like in shift work, as Silja mentioned, because of the extra burden there. But I think the core of the discussion in Iceland, and maybe I hear a little bit of it here in the panel, is like Silja was mentioning, I mean, is it a real choice, or is it because of how the system works? Is it like a systematic pressure? And of course, we know that the reasons for the gender pay gap are multiple, and research also tells us that you kind of have to combat each and every one of them if you want to reach full gender parity. So we're talking about the gender segregated labor market. We're talking about the power and influence, like who gets the highest positions and the salaries, who has the decision-making powers. We're talking about stereotypes. We're talking about work and family life balance, and of course then part-time. So I think we could be here for many days, but I'll conclude for now. Thank you.
Thank you. Thank you. Maria, do you want to ask the question?
Yes. First of all, I would like to comment from the Greek point of view. It's really amazing to listen to all these questions of part-time or non-part-time, or these problems of conciliation of work and family. Also in countries like Iceland and Norway, that in our perception, there are countries with a strong social welfare system. And we didn't expect to have so similar problems, because Greece is at the bottom of the indexes of the European index on gender equality, at the bottom. And maybe other countries like your countries would be, if they were in the European Union, would be really at the top. So it is important for the Greek public to see that we realize this. But I wanted to raise another issue that I think is very important, again, because we have all these ideas about the Scandinavian welfare system. So about what is the important, how it works, and what is the importance of the public versus private sector in the health sector. Because in Greece, before the pandemic and still, I mean, there have been a lot of efforts to reduce the public sector on the health system, in favor of the private one. So now we realize with the pandemic that things, I mean, are not. Maybe need to go back to the public control of the health system. So I would like to ask you how it is there, and if this if this you can think that there is any impact on gender and on working time, like you said before, or on other aspects of gender differences regarding the employer. Who is the employer, the state or private, small or bigger companies? So this is my question. Mostly for the Icelandic and Norwegian colleagues.
Okay, so I can shortly answer.
Yeah.
So in Norway, the healthcare is mostly public. It's a very small private sector, and they are, let me say, they do mostly cosmetic surgeries and stuff like that. But it's of course it's a never-ending debate between the right and left side in Norwegian politics. How big of a private part should we allow into the public sector and healthcare in general? But I would say that also the right side, the right wing in Norwegian politics are quite protective over the public healthcare sector, and more now than ever because of the pandemic. And in a country like Norway, where we live in like the strangest places in the middle of the forest, and there's like an hour or two to the next town or the next house, there is no market for private healthcare. So in large, there is public, but of course we are a country with a lot of people that have money, so they can buy private healthcare and in private insurance, and it's more and more of that. So we're struggling to like keep the public discussion, to keep the public unity, that we protect the public healthcare system, the public school system, or the welfare state that we are so proud of. But I think it's going to be more private in the future, just because we cannot the level of care, the level of competence in the public sector. I think it's going to be very difficult to keep that in the next 10, 20, 30 years, when we see how much people we lack. Actually, nurses. I was saying that we lack 6,000 nurses at the moment, and in 15 years we will lack 30,000 nurses. And also my colleagues from Greece said something very important, and that is that we in Norway we have a lot of migrant nurses from mostly Sweden and Denmark, but also other European countries, and we cannot keep up stealing the nurses from other countries that need this very high qualified workforce themselves. So yeah, it's a big discussion, but we definitely need the public sector healthcare.
Okay. Would anyone else like to say a few words about the question that Maria raised?
Sonia, wouldn't you go, because I think it's you have a more experience of the health sector than.
Well, it's a very similar answer as Silja mentioned. I mean, mainly it's within the public sector. We have, well, maybe a more variation of surgeries being made in the private sector than just cosmetic, but it's still very small. But the public debate is very heated, and now we're up for elections next fall, so we will kind of see. But right now we have a left-wing health minister who is trying to push back on the ministers before her on the right wing, and trying to, just ensure equal access. And of course, we have the same problems. I mean, most of Icelanders live on the southwest coast of the country, kind of very condensed. But of course, there's a various around the country where very few people live, and then there's the question of equal access, and of course about the cost of getting health. What's it called? Health service. But I mean, we have the same problems with the shortage of workers, as Silja mentioned, and that's why the shorter working week for shift workers within the public sector was one of the major steps that we were kind of trying to take, and it will come into effect next May. So we don't know the results yet. We don't know, but it should be, and that's one of the main objectives, is so that shift work will be more appealing and more will want to work shifts, and also to try to reconcile family and working life. So we will kind of have to see what the next government does, but the unions will for sure push forward, because, I mean, to put it very mildly or shortly, capitalism does not favor feminism. So if it would go over to the private sector, I mean, we have a lot of research and many academics who have gone over this question, and we know for sure what will happen. So we're pushing for public health service.
Thank you, Sonia. I think if there are no other questions, are there any other questions? I cannot see any other questions from Is there anything?
No,
okay.
there aren't.
So we don't have a lot of time until the end of the session, but I would like to end with each one of the speakers giving us a short response to what needs to be done. How do you think that governments should respond to the needs of these essential workers? And especially, I would like us to think of the long term rather than just patching up the problems that emerge right now. What are we doing about the long term, and how we can deal with the very important problems that were there before the pandemic, and now they became huge, but they were definitely there before, and they will continue to be here. So I would like to start from the last speaker. Christine, would you like to say a few words about what needs to be done with regards to sexual and reproductive rights?
Yes, thank you. It's a big question. I have already mentioned the need for research, more research. I think that will be very important now when trying to figure out how to deal with the next crisis that we might face. And other thing is to for our governments to keep up the level of official development assistance. That's something that we are working a lot on, to keep up development aid for sexual and reproductive health and rights, to civil society organizations, to also multilateral organizations such as the World Health Organization and also the United Nations Populations Fund. And a third thing that I think is also important is to support new and innovative solutions to reach broader with information and services. We have seen examples on that already, also from our member associations in IPPF. Since the outbreak of COVID, a lot of them have expanded their technical services so that they can provide comprehensive sexuality education for young people online. They're providing telemedicine, virtual counseling, consultations and follow-up. They provide support for self-care or self-testing for HIV, medical abortion, contraceptives, all these new ways and solutions that we see, and we see that they're working. One example from our sister organization in Palestine, they have had a lot of their clinics, physical clinics, closed, but they have had for the last year an increase in the numbers of clients they have reached out to. Okay. So also support for these new innovative solutions that hopefully can bring us something positive out of the COVID pandemic.
Okay, thank you, Christine.
Thanks.
Now we move on to Aurora. Aurora, could you tell us what you think should change with regards to migrant care workers? How should governments respond, and what should be done?
She's not connected, I think, Nelly.
It says connecting to audio.
Yes, but
can you hear? Can you speak, Aurora?
Yes, hi.
Okay.
Okay. I think, yes, I think the government should try to make more restrictions, or to be more specific in giving restriction orders, because I think the problem is getting bigger here, and I think we need more facilities, hospital facilities.
Aurora, can you hear us?
Yes.
We lost the connection for a while.
I think the government should try to pursue to support. Oh no, I mean, or the people must support the government for these coming vaccines, because I don't know, we're having a bigger problems as months go on. I don't know what we have to do to stop this pandemic, and what the people can do also to support each other, and I don't know.
Aurora, I think that what you're saying is really important, that we need to prioritize care workers in the vaccine programs. And I think not in Greece, at least, it's very important to also prioritize migrant care workers.
Yes,
because otherwise we will not have, things will not be easy if we don't accept the fact that a lot of care work is privatized. So we have to move on because we don't have too much time. So just try to be quick in your responses because we are almost ending. So Dimitris, would you like to respond to this question? What needs to be done from your perspective, from your Dimitris Haralabopoulos, are you here?
Sorry.
Okay. I think the connection is a bit, we can't hear you. Maybe we move on to Sonia. Sonia, would you like to say a few words about what needs to be done and how governments should respond to this, or international organizations? Because Christine also raised the question of international organizations and how they play an important role in such policies. So.
Well, I think first of all policymakers have to realize that gratitude alone does not bring food on women's tables. And I think also that the focus point or the view of the society has changed. Before we kind of thought of finance and real estate and such things that kind of were visible things as of high value, but they are not kind of the foundation of our society. So we kind of have to re-evaluate that, I was going to try to say. But I mean, policy making, of course, safety at work has to be #1 priority. We have to ensure everyone full-time work, and also to make it both a free choice regarding their family and the working life reconciliation. We have to stop outsourcing and privatizations to ensure that you have the rights that you need working. Also, we have to take a big discussion and change the working culture, because we know that it can be very harmful for women. I mean, Me Too and all of that. And last but not least, we have to ensure pay equity. We have to stop talking about only equal pay within like an organization and talk about pay equity for women's jobs across the labor market compared to men's jobs in the labor market. Thank you.
Thank you. Now, Denise, would you like to say a few words, please?
Yes, in the nursing point of view, the policymakers, the health makers, to be specific, they must include the nurses to the strategic plans of the health system in Greece. They also have to find a way to get more nurses to the system, because all the years which the national health systems works, it works under 60% down from human resources. We are off the limits. They must find a way to get nurses into the system, because the Greek nurses, they have fly away from the syndrome of burnout. We have gone to another dimension of this burden. But first of all, we have to change the culture in Greece, how they see nurses, because in Greece, doctors are in the first steps. The doctor is the #1 on hospital. With the doctors, we are partners. We are not their assistants. That is one thing that the pandemic make it clear to the society, that the work of nurses is something different than the work of doctors. And we have to try more to pass to the Greek culture that the nurse is something else. And the government and the health system must include nurses to the policymakers.
Okay, thank you very much. Now we move on to Sile.
Thank you. So thank you so much for a lot of thoughtful and very wise speakers before me. And I think I'll just they're saying so many things that is relatable to also Norway and Norwegian nurses organizations. So, and I have learned that if you don't have a seat at the table, just bring your own chair. And I would say that that's actually a quite important phrase to take with you, because we need the voices of the workers in the healthcare sector, mostly women, when we're prioritizing this sector. And that is the most important point for me, that we need to prioritize the healthcare sector. We must not downsize the public healthcare sector. It must be robust enough to handle this kind of crisis. And we must have a strong public sector where we educate our own nurses, our own doctors, and we do not steal them from other countries that also are in lack of this very important competence. So thank you very much.
Thank you. I mean, I don't know if Dimitris Haralabopoulos is able to use his microphone now. Would you like to say before Christine? We will end with Christine.
Okay, thank you. Sorry for before.
Okay.
Okay. Well, first of all, the first thing that the governments must be done is to we need more nurses in the system. We are all old, as you can see, and we need nurses to come to the system. And the government must be understand that we are not able to have a healthcare system without nurses. So we must be in the tables. We must have. They must hear our opinions, and this is. Thank you.
Thank you. And Christine, you are the last one.
I'll just thank you all for this very interesting discussions. They have been very enlightening. I think we have to also, because I'm the only one that comes from the educational care sector, that we have to remember that we are all a chain. We are all part of each other's foundation. So in Iceland, we are facing a shortage of people wanting to be preschool teachers and teachers also, and that is because of the working conditions mostly, and because of the equity of the pay, as Sonia mentioned before. So I think that for the government, municipalities or the national government, they need to look at us all as a part of the same, and to that, you know, you cannot build a system on shoulders of those that are in the lowest part. You have to also acknowledge the lowest part and the people that are in the foundation. So I think that would be my kind of just last words.
Thank you very much. Thank you all for your participation. I think it was an extremely important and timely discussion. And I hope that what's happening now during COVID-19 will influence the future, and we will have more gender equality in these sectors, but more broadly, more respect for essential workers. Thank you very much, and hope to see you in our next events. We will keep you updated. Please subscribe to our Facebook page, and thank you again. Have a nice end of the day.
Thank you all.
Thank you.
Bye-bye.
Good afternoon. Bye.
Bye.
Good afternoon.